So today we are going to talk about nutrients as it relates to mental health, which is just a wonderful topic that doesn't get enough attention. Often it's not hard for people to jump to, having a physical illness because of a nutrient deficiency. But I think sometimes the leap is a little bit harder for folks thinking about mental health and nutrients. And is there a role, and how significant of a role is it? So it's definitely one of the reasons I wanted to talk about this today. I know this is the caregiver support group, but I think you'll find as we go through and go along, a lot of this might pertain to yourself, but it'll also pertain to the person that you're caregiving for, or friends and family as well. That'll hopefully spark some great dinner time conversations. All right. So what my plan is, I'm going to go through just some nutrients, kind of high level nutrients, which nutrients tend to have the biggest impact on mental health, whether it's depression, anxiety, or even other mental health illnesses like schizophrenia, ADD, ADHD. So some of those, even like bipolar depression types of illnesses. So I really want to start kind of just by going through some of those nutrients, listing out what they are, maybe where they're found, in the roles that they do play. And then I'm going to dig into really, lifestyle and how that has a role as well. So get your pens and papers ready, take some notes. So, nutrients to support mental health, right? So I always like to start off by talking about healthy fat and omega-3 in particular. So our brains are made up of fat. We are big fatheads. The consistency of our brain, it really is akin to almost like butter, like a nice soft butter, because it is made up of so much fat. It's supposed to be made up of a good ratio of omega-3s, those healthy oils. You've probably heard about omega-3s from fish and fish oil, maybe even some plant sources. But when you don't have enough of these healthy fats, it definitely can trigger depression and anxiety in quite a few people. So, where do you find these types of healthy fats? Of course, I mentioned fish and fish oil, but also some plant-based sources as well. So things like flax seeds and chia seeds are exceptional. Even walnuts are exceptional. And because you want to make sure you're giving your body the right mix of fat, so that your brain can reproduce itself, or because you do make new brain cells. It isn't static like we once thought. We're constantly making new brain cells. We need to be able to support our brains in that way. So making sure you have the right mix of fatty acids in your body, not only is going to make sure your brain is made up of the right type of fat, but also it's, your omega-3s are incredibly anti-inflammatory as well. So a lot of what we're finding out more and more, as I go off on a little tangent here off of omega-3s, is that mental illnesses, depression, anxiety, it does have some sort of a root cause in inflammation in the body. That when you have inflammation in the body, you have inflammation in the brain as well, and it definitely can trigger some of these mental health conditions, especially if you're predisposed to it. Maybe you have a family history of it, or just a personal history of it that you've been struggling with. Having this low level inflammation in the body and in the brain can make it really hard to overcome. So getting these healthy fats will help decrease inflammation tremendously, just throughout the body, but of course in the brain. So making sure that you're eating fish a couple times a week, some of the lower level fish, the little guys, the sardines and the anchovies, the things that don't have very long lifespans, because the longer they're alive, the more likely they are to accumulate more environmental exposures and toxins. So we don't want a ton of that either. So it's that nice balancing act when it comes to omega-3s. And I should have said at the beginning that I'm not making any sweeping supplement recommendations for anybody on the call. As I go through these different nutrients, it doesn't necessarily mean I need you to run out and buy an omega-3 supplement, because supplements are going to be very uniquely tailored to the individual. There is no broad generalization that I want to make for everybody on the call to say that, yes, you absolutely need to go run out and buy omega-3s. A lot of these supplements will interact with other medications that you might be on, or just not recommended for you because maybe you're just fine. And in this country, we tend to think that because a little bit is good, a lot must be better, and that's not always the case. So, if after we're done going through all of this, you have individual questions about any of these supplements, I definitely recommend talking to a physician, or if you have access to CTCA's naturopathic departments, I would definitely recommend you speak to them. Ultimately, I try to get all of my patients and clients to get most of their nutrients through food, because it is very doable in a lot of cases. But if it's not, definitely speak to your physician or naturopathic doctor. I should have started with that, so I'm so sorry. So, we've talked about omega-3s and the importance of them and where to get them. Talking about, going through the list of nutrients, starting with omega-3s, I then like to go on to B vitamins, right? So how important are B vitamins? Incredibly important. There is some really great, strong research coming out looking at the association between having low levels of B1, B2, and especially folate. You may know it as folic acid. In that, there was actually some really interesting research I was just reading kind of in anticipation of this call that was looking at the blood levels of folates in people that have depression, diagnosed depression. And it was found that in that group of people, they have generally 25% reduction in the amount of folic acid or folate in their blood than kind of a healthy population would. So and that has been repeatable. It's been found in many studies that B vitamins, of which folate is a B vitamin, that it seems to be some sort of a predetermined factor, that if you have low intake of these, that you tend to have higher rates of mental illness, depression, or anxiety. So ensuring you're getting in your B vitamins is incredibly important. So, where do you get these? Your folate, I think most people are familiar with folate and folic acid because it's been fortified in a lot of processed foods. So all your breakfast cereals and your breads, you'll see, all the B vitamins listed out. But from natural sources where you're supposed to be getting it from, your dark leafy greens, of course. Wouldn't be a proper dietitian if I didn't recommend dark leafy greens at some point in this phone call. So all of your dark leafy greens are going to just be wonderful, exceptional sources of folates. And also your whole grain foods, things like your oatmeals, brown rice, things like that. Even your beans and legumes. So whether it's lentils or black beans or chickpeas, excellent sources of natural folates. So folic acid is an artificial form of folate that has been made to fortify foods with. And what we know is that your body, most people actually absorb and process the natural form found in food, so the folate, much better than that folic acid replacement that we take often. So not that it's necessarily harmful, but if you think you may have lower levels of B vitamins, maybe genetically you're predetermined to have lower levels of B vitamins, that's definitely a case in a large portion of the population. Definitely look into getting more natural sources. So things like your beans and legumes and your whole grains and your dark leafy greens, we'll focus in on that for you. So moving on from your B vitamins, I want to take a second to talk about amino acids. So protein is made up of amino acids. So amino acids are your building blocks that create proteins in the body. Now, amino acids do many things. Not only do they help to create muscle, they also are the precursors for many of the neurotransmitters in the brain. So you may have heard of some of these neurotransmitters before. So things like dopamine and serotonin, right? We've heard of these things at one point, probably more so with depression. People that have low serotonin or low dopamine maybe are put on medications to help replace that, or this SSRIs, the serotonin uptake inhibitors, so that you have more serotonin floating around in your brain to help lift your mood in the event you have depression. So what happens is if you don't have enough very specific amino acids, you actually don't give your body the building blocks to create serotonin in the brain. So I want to make sure that I focus in on that. It's particularly with the cancer oncology group of people, I do get a lot of people who come to me trying to have gone vegetarian or vegan or just more plant-based, which is wonderful, because in the cancer world, we definitely want people to eat as many fruits and vegetables as possible, right? But in that, sometimes there's a trade-off where maybe you're not getting in as enough protein as is required to give yourself the building blocks to create this serotonin in the brain that we need. Now, it's quite possible and very feasible to do a vegan or vegetarian diet healthfully. Just make sure you're getting in enough of those good protein sources. The thing is, with plant protein sources, they tend to not be what we call complete proteins. So they don't have all of the amino acids required to build muscle and to create the neurotransmitters in the brain. So it takes a little bit more work. You might need to piece part different foods together to make sure that you're getting all the required amino acids versus plant-based foods, animal foods, things like all of your meats and your eggs and your cheeses are what they're called complete proteins. So they contain all of the amino acids required and necessary. So just a little shout out to my plant-based people. Just make sure you're getting in enough protein. Speak with your dietitian, or make sure you're using an app of some description that will actually track the different amino acid ratios to make sure you're getting enough. Getting enough in will definitely help reduce any sort of depression and anxiety for yourself and the people you're caregiving for. So just something to focus in on. Moving on from kind of your amino acids and your animal foods, I like to take a moment to talk about your minerals. So all of your minerals, things like magnesium, iron, and zinc, are quite important. And we find that a lot of people tend to have a low-level deficiencies in many of these minerals. Big reason is we're supposed to be getting them from our foods, from our plants, and there's soil depletion going on, in mass-produced foods. So if the nutrients aren't in the soil, they're not there for the plants to take them up for us to eat. So we end up with kind of these low-level deficiencies. I think I read some research recently that most people are deficient in magnesium to some level, maybe just a little bit, maybe a lot. So, and it's really hard to know if you're one of those people. It doesn't really show up well in blood work because your body does a really good job of maintaining your blood serum levels of some of these minerals because they're important for life. But do you have enough to support healthy brain function? Hard to tell. So focusing in on foods that are really great sources, things like nuts and seeds. So when you're talking magnesium and zinc, pumpkin seeds are wonderful, almonds are wonderful. All of your nuts and seeds are going to be really great. And of course, going back to your animal protein sources are going to be really great sources of iron and these minerals as well. So making sure you're getting in enough of those, not only are they going to support mental health, so magnesium is a really great relaxation mineral. If you're someone who has just a constant on edge anxiety, maybe has a hard time falling asleep, maybe even has just like muscle tightness, you can feel it, you may benefit from taking in more magnesium. And whether that's in a supplement form or not, it's going to be between you and your physician. But getting in enough magnesium can really help just all of that kind of underlying tension and anxiety you don't even know you have. Just personally, anecdotally, the first time I had taken a magnesium supplement, I just felt this come over me, this like release. And I was like, wow, this is incredible. I had no idea. Even a dietitian like myself who tries to eat healthy and well balanced, I took that as a sign as I probably wasn't getting in enough magnesium. And so special focus in on all of those foods that are really rich, as I had mentioned, your nuts and your seeds are going to be wonderful. Even some of your dark leafy greens are going to have these minerals in them. So things to focus in on. If you have been around in any of our CTCAs and you have met with a dietitian, you have probably heard us talk about vitamin D. So vitamin D gets a lot of attention, especially in the cancer world, just because there's some really great research linking vitamin D to immune support. So having a better immune system, it's been linked to your metabolism. I mean, vitamin D just works in hundreds of different ways in your body. Low levels of vitamin D are being seen are being linked to higher rates of certain types of cancers. So it's something that we keep an eyeball on. But actually, low levels of vitamin D are also implicated in schizophrenia, believe it or not. And having low levels can trigger different types of mental conditions in that way. So where are we supposed to get vitamin D? The sunshine. Now, I'm not sure where you're living, but I am in the Northeast. I'm from the Philadelphia Center, and I don't get to see a lot of daylight. I don't have any windows. There's a fake window behind me. It doesn't really open up to anything. So if you're anything like me, you work inside, plus with COVID, everybody's inside. You're not going outside as much. We're not seeing the light of day. And now we're coming into the winter, so we're not seeing any sun at all. So in the absence of seeing any sunshine, it's most people are recommended to have a supplement. And now, as I said in the beginning, I can't make any blanket recommendations for supplements, only because everyone's in a different place. And vitamin D is one of those things that you can get too much of over time. So I don't want you to run out and buy a vitamin D supplement necessarily, but probably a good idea to have your level checked the next time you go to the doctor. It's really easy to add on to any routine blood work, see where your level is, and a supplement might be recommended for you. Only for the hundreds of different reasons that vitamin D is good for us, but definitely to support mental health as well. So take a look at that. There are some foods that are fortified with vitamin D. There's not a heck of a lot of them out there. Dairy products tend to be fortified with vitamin D, so often I'll hear that. You know, what if I just drink a lot of milk? I mean, it can help a little bit, but if you have a deficiency, honestly, you should have your level checked, and a supplement is probably the only way to go. You know, other foods that have vitamin D, I had talked earlier about sardines. So sardines are actually a decent source of vitamin D because most people tend to eat the bones, and there's a lot of vitamin D in the bones. So if that sounds like a good idea to you, feel free to go ahead and eat those. You'll have a double whammy with the omega-3s they contain for brain function as well. Excuse me. One second. Okay, all this talking always drives me out. So as we're going through, so we've hit, you know, your omega-3s and your B vitamins, your amino acids, your minerals, your vitamin Ds. You know, I always like to talk about just plant-based nutrients as a whole and the antioxidants that are in plant-based foods. So, you know, we always talk, especially in the nutrition department, we're always talking about fruits and vegetables. You know, why do I want you to eat them? Why are they good? They're great cancer fighters. They're great for overall health. And we know that. But your plant-based foods are very rich sources of antioxidants, things like polyphenols, which may be words that you've kind of heard throughout the course of all of your learning about nutrition. But what are these things? So antioxidants actually, the way I like to describe it is they actually kind of go through and they mop up all the stress in your body, right? All of the, it's oxidative stress is actually the word. So what oxidative stress is actually called rusting. So if you've ever left an apple sitting out after you've cut it, or an avocado, and you see how it browns like that, that browning is actually oxidation. So oxidative stress is a very similar process that happens in your body and in your brain. So it's actually quite literally like a rusting or a browning of what's going on inside of you. So fortunately, we have a way to prevent this, and it's with those plant-based nutrients, those antioxidants. Now, there are no bad fruits or vegetables, but there are definitely some that are better than others when it comes to their antioxidant levels. So high levels of antioxidants can be found in all of your berries, all of your really rich, deeply colored plants, really. So your deep leafy greens, your deep oranges, your deep purples, those beautiful colors, that's where you're going to find the richest sources of antioxidants. And as I mentioned before with the omega-3s and their anti-inflammatory benefit, plant-based foods and all with these high antioxidants do very similar things. They really help to reduce the inflammation going on in your body, not only just in your body, but in your brain. They can really help to just support your whole health, support your mental health. They've been shown to reduce levels of stress, anxiety, and depression. So, I mean, ideally, most people would be getting in, those 5 servings a day. You've probably heard the 5 a day campaign was getting in all those servings, but really 5 is a minimum. It shouldn't be the goal. You should aim for a minimum of 5 a day. But the more the merrier. The American Institute of Cancer Research recommends anywhere from 5 to 9 servings a day, which can be a lot of produce. But if you're getting 5 to 9 servings every day, you're almost guaranteed to get in all of the nutrients that we've been talking about throughout the course of this webinar. All of those minerals, all the nutrients, and all of those wonderful antioxidant and cancer-fighting compounds, mental health supporting compounds. So any of the deep leafies, any of those berries is really where it's at. One thing I want to make sure that I touch on is kind of this fad with low carbohydrate dieting, whether it's the keto diet or the carnivore diets, Atkins diet, South Beach diet, there's a ton of them. All of these diets that really are restricting carbs. I think it's all the rage right now, and there's definitely a lot of benefit that people are seeing with weight loss and maybe even reversing diabetes. But please know, if you are someone or someone that is struggling with mental health issues, whether it's generalized anxiety, depression, or even something like your schizophrenia or your bipolar, low carbohydrate diets are not recommended. So carbs have a profound effect on mood. Carbs are known to trigger insulin, right? That's why our diabetic folks are like, let's try this low carb diet, so that we're not triggering so much of that blood sugar response. But so while insulin is allowing blood sugar into the cells, it also simultaneously is triggering something called tryptophan into the brain. So tryptophan, you might have, turkey season, right? Thanksgiving is upon us, and everyone knows probably tryptophan from turkey. So you eat your tryptophan, and what happens? You get all full and sleepy and you go to bed. So what tryptophan actually induces a sense of tranquility in the body. So low carb diets tend to limit this. But this is also why sweets tend to make us feel good. So this is one of the reasons why people say sugar is so addictive, or that when you're stressed out or you're just not feeling good and you're anxious and you just want that cookie, you want the cake, you want those sweet treats, or maybe just those, maybe you're not a sweets person, but you're just like, oh, I need bagels, I need pizza, just those carbs. And just even talking about it, you're just like, oh, it's so good. Because it really does provide a temporary lift of the mood for those reasons. It allows tryptophan into the brain, it triggers all those happy feel-good feelings, but unfortunately those are very short-lived. So, supporting yourself and supporting your mental health and your anxiety by kind of stress eating carbs and sugars, not what you want to do for many reasons that I won't dive into too deeply, but for a lot of obvious reasons. But just to circle back, if you're anyone struggling with depression, mental health, anxiety, low carb diets are not the way to go. You don't want healthy carbs. You want things like sweet potatoes and whole grains, things that are going to support your body, support your energy levels, without giving you the super sweets and the crashes that you get after eating something too sweet. Because if you're on that blood sugar roller coaster, it's not doing you any good from a mental health or physical standpoint. So that's kind of where I want to stop for a moment, just to kind of say, all right, so we've gone through specific nutrient groups and kind of some specific foods associated with those nutrient groups. I would be remiss if I didn't take a little bit of time to talk about all of the wonderful research coming out about the gut microbiome, which is really, really cool stuff. And if you've never heard of it, I'll give you a real quick 30,000 foot view of what that means. So the microbiome is a term given to all of the bacteria that live in and around and on our bodies. What we're discovering is that there are actually something about 10 times more bacteria on and in and around us than there are actually cells in our body. So the bacteria that live in us actually outnumber us almost 10 to 1. So we are more bacteria than we are human, which I think is just mind-blowing, but really cool stuff. But with all of the research coming out about the influence that these little buggers have on our health, they're finding more and more association between the makeup of the bacteria that live in your gastrointestinal tract, so that's the microbiome, and mental health. And when there is an upset of the ecology of those types of bugs living inside of you, the direct cause and effect of mental health and depression. I did read some research, and I'm sorry I can't quote it off the top of my head, but I read it a while ago. Looking at what they did was they were able, the scientists and researchers were able to manipulate the types of bacteria living within the subject, and were able to directly influence levels of depression, levels of stress and anxiety, just by manipulating the type of bacteria that are within the body. Now that's pretty cool stuff. You may start hearing about something called the gut-brain axis. So without digging too deep into that, all that means is that the mind and the gut are talking constantly. It's a two-way communication. You know, you get that gut feeling, right? Or those butterflies in your stomach, or you get that nervous tummy. Maybe you have to give a webinar to a bunch of people and you're nervous, so your stomach's all in a bunch. Maybe you have to run to the bathroom. You know, and that's because of that gut-brain axis. It's the feelings and the emotions, it's the neurotransmitters, it's what we're feeling, and how that directly relates to our gastrointestinal tracts in our body. And all of that is bacterial driven, so very, very neat. Now, this doesn't mean you need to take a bunch of probiotics. So the biggest influencer of your gut microbiome and whether it has the right mix of bacteria or not is what you eat. So bacteria have a very short little lifespan. They live and die very, very rapidly. So as a result of that, if you shift your diet to a diet that favors healthy bacteria, you're going to see a shift in the entire makeup of your microbiome within just a couple of days. So within a couple of days of making some shifts, which I'll get into, you'll start to see a shift in the bacteria. You can start to see a shift in your mood, your anxiety, stress levels, all of that stuff, which I think is just really, really neat. So what do we do to feed the good guys and get rid of the bad guys, right? So not surprisingly, we'll call them the bad guys, or just the imbalance, because right, we want everything to be where it should be. So we'll call them the bad guys, but the bad guys like to feed on sugar. So the processed foods, the sugars, all those foods that, you know, you're being told all the time aren't good for you, or you probably shouldn't be eating. Well, this is just another reason why. So not only do food, you know, those real sweets, processed foods, sugary foods, not only do they contribute to, you know, weight issues or blood sugar issues, inflammation issues, brain issues, they're also leading to microbiome issues. So they're allowing the bad guys to grow and overtake the good guys. And then we want the good guys to support mental health, among a million other things we're finding these things do. So by reducing processed foods and sugars, you'll starve those guys out. You'll allow the other guys to grow. Now, but the other guys, the good guys, they're not going to grow if you don't feed them what they need. They need fuel and food as well. So they like to eat fiber. Where do we get fiber from? Fruits and vegetables. So it comes full circle. Just another reason for me to tell you to eat your fruits and vegetables every day. Fiber is really, it's kind of like fertilizer. It's plant food for those good guys, for those good bacterias. So plants, in addition to, you know, supporting healthy weight, having all those anti-cancer properties, you know, all those anti-inflammatory properties, brain supporting properties, they're supporting your gut microbiome so that your gut microbiome can support your brain as well. And it'll come full circle for you. So I wanted to touch on that to kind of give you the 30,000 foot view of what's going on inside of you from a gut microbiome standpoint. It's a fascinating area of research. If you start typing it into Google, you will just be inundated with some really neat things. So I encourage you to take a look at it. Even start looking up, you know, microbiome and mental health, microbiome and stress, anxiety, and you'll see just this amazing amount of research coming out. But again, not necessarily, you know, need to run out and take a bunch of probiotics or prebiotics or anything like that. You know, but really focusing in on whole real foods And like I said, you'll notice a difference within just a couple of days. So it's not one of these things where, try it for 30 days and see how you feel. I mean, honestly, within a couple of days, you really start to notice some real changes in your body and in your health. So with that, I have been chatting at you for about a half hour now. So I went over my self limit of 25 minutes because I just get so excited talking about this stuff. So hopefully you've written some stuff down, have some questions for me, and I will I'll check out the chat to see if there's any questions in the chat box. Feel free to raise your hands, and I will take some. Okay, I see I have a hand raised by Chris. Chris, I will unmute you. I will try to unmute you.
I did it. We did it. We did it together.
Great. All right, Chris. Hi. What's your question?
Hi, I am, quick in a nutshell, I am unfortunately stage 4 and I have chemotherapy every 3 weeks, and I'm human and I'm getting to magnesium, and my doctor is reminding me every 3 weeks when I have my labs done that my magnesium is tremendously low. So when you talked about that, I don't know, 20 minutes ago, but in this event, do you have and I'm not saying write me a prescription, I heard what you were saying, but do you have a good magnesium supplement recommendation?
So are
besides
you looking...
besides the eating the leafy greens, the spinach, yep, the pumpkin seeds? I'm trying. We're all trying, right?
Yeah, absolutely. That's a really great question. And unfortunately, with a lot of these chemotherapies, you can eat all the magnesium in the world, but these pharmaceuticals and these drugs just take it right out of you. And it really does come down to, you probably do need to take a magnesium supplement. Now, as far as specific brands, I love our CTCA brand, the CNCA brand, if you have access to that, because I know that we quality check it, because there's so many supplements out there that they don't have in them what is advertised in them, because they're not controlled in any way. So if you have access to our brand, I love it. I see great results with it as far as actually helping to improve magnesium levels. There's many forms of magnesium. There's magnesium citrate, which is very helpful if you're having trouble going to the bathroom. It'll help you move your bowels. So just for getting magnesium levels up, I would not recommend a citrate, because you're just going to end up going to the bathroom a bunch. Magnesium glycinate is a form of magnesium that doesn't have such impacts on the bowel and can help to raise magnesium levels up. Now, it's as you said, I'm not a physician or a naturopathic doctor, so I can't recommend like a dosage or a frequency, but that should be enough to get you started. Maybe you can work with your doctor on how much to take.
Okay. Okay. Yeah. I mean, I wasn't asking you dosage. I just wondered. Okay. I mean, you go to the pharmacy, whether a naturopath writes you up or a doctor writes you up a prescription. Yeah. Like I went to the pharmacy with a naturopath prescription for D3, and I mean, this was months and months and months ago, but and I'm still taking it, but the pharmacist immediately recommended an over-the-counter D3, which was actually better than a prescription that she had. So good. I mean, again, what I'm leading to is you go to the pharmacy, and I mean, the over-the-counter, and there's like tons of supplements. So I was reaching out to you and anybody that's listening, if you had any good recommendation for that supplement. I don't want to take something, I don't want to grab for a bottle. Oh, this says magnesium supplement, and take that, and it's not doing anything for me.
Exactly. Very smart to ask. Like I said, look, don't get a citrate, go for a magnesium glycinate. I like our brands. If you're looking for a couple other brands, I think Vital Nutrients is really good. Thorn Nutrients, Pure Encapsulations. I mean, these are just great brands. There's a lot of really great brands out there. I'm not affiliated with any of them, you know, disclaimer for the webinar, but they're really high quality products, and I think you'll have good results.
Okay, all right, thank you.
You're so welcome, Chris. Okay, we'll put you back on mute. Let's see, I don't see anybody with any questions in the chat. So if you have any questions, please let me know. Raise your hand, put it in the chat. All right, looks like there is a question from Maggie, which I'll read to everybody. It says, I'm always concerned about absorption. For example, I know dairy can inhibit iron absorption and vitamin C can help with iron absorption. Are there any combinations like that we should know of, or we should know about related to the vitamins or minerals you mentioned? Ooh, good question. So yeah, I mean, with a lot of nutrients, there is competition. There's only so many sites of absorption along your intestinal tract, and a lot of them do compete for the same sites. As far as, you know, iron, so you want to make sure you're taking iron away from anything that has tannins in it. Coffee, tea, wine, for example, can inhibit iron absorption. Like you were saying with the dairy, yes, vitamin C definitely helps with iron absorption. You know, there's a lot of talk right now about what are they? Phytates in beans and legumes. A lot of talk around that. But you know, what we found is that while certain nutrients have anti-nutrients, they're called, only because they do block absorption of different nutrients, there generally isn't any concern for getting a deficiency because of this kind of competition. You know, if you are specifically low in an iron or in a nutrient like iron, I think those recommendations that I gave can be very valid. But if you don't necessarily have a baseline deficiency and you're eating a well-balanced, healthy diet, you're going to get enough where everything gets absorbed in its own time. There isn't anything that's a big blaring, never eat this with that type of recommendation. Okay. Any follow-up questions? Anything else I can help with? Looks like we have about 10 people on the line, which is great. All right, so we have another question that came through. I'm currently taking CalMag Plus with K27, a dietary supplement from the pharmacy at CTCA. Okay, that's a great comment. I don't know if there's a question there. Vitamin K27 is wonderful. So K27 is actually something that is produced by a healthy gut microbiome. So thank you for bringing it full circle back to my favorite topic. And vitamin K27 has been shown to help with mineralization of the bones. So if you're somebody with osteoporosis or you're just looking for bone health, K27 is wonderful. It is why it often comes in packaged with different calcium supplements or vitamin D supplements. You'll kind of see that starting to be tagged alongside it. But like I said, if you have a healthy gut microbiome, then your body's actually producing that on its own. So it's a great, but for bone health, I think that's wonderful. Thank you for your comment. Any other questions? Raise your hand, take yourself off mute. Okay, well, if nobody else has anything.
I have a question. I have a question. Can you tell me the difference between magnesium and manganese?
Magnesium and manganese. Yes. So they are very different. You know, they're trace elements that we need in our body. Magnesium and manganese. Trying to think the best way to describe this. So they're, you know, much like a lot of the minerals or trace elements that we need in our body, you know, they perform just various different functions. So manganese is something that we need for not only like immune support, and it has some anti-inflammatory benefits as well. And magnesium, as I said before, is more of an electrolyte that helps to help with stress and anxiety in the body. I mean, I've never seen anybody with a manganese deficiency because our physiological requirement for it is so tiny, and it is pretty plentiful. And you find it in a lot of foods that you would find your other minerals in. So some of your plant-based foods and even some of your like your nuts and your seeds, for example. Does that answer your question, or is there something very specific you were looking to learn?
No, I just hear you had briefly mentioned manganese earlier, and I keep hearing it just casually. People don't really stress manganese as much as they do magnesium. So I was
Yeah.
just trying to find out what the difference and the benefits were.
Oh, okay. Yeah. Your manganese is starting to you get a little bit more attention. You know, it's like I said, it's nothing that I ever see anybody have a problem with or deficiency in. Where magnesium, unfortunately, is something that most of the population tends to struggle with. So that's why there's a little bit more focus on magnesium and where to get it and how to get it appropriately.
Thank you.
You're very welcome. Okay, and then I have a question in the chat box. So I'll read that one. It says, any recommendations between canned versus dried beans? That's a good question. So canned versus dried. So there's definitely pluses and minuses to both, right? I think beans in general need to be included as part of a healthy diet. You know, the people who live the longest in those blue zones tend to eat beans every day. So, I mean, canned beans, dried beans, I think they're equally nutritious. One's just a lot easier than the other. So canned beans, I like, you just got to make sure you rinse them really well. You know, if you have issues with blood pressure, make sure you're not having salt added. But as far as like the nutrient quality between the two, very, very similar. So whatever is easiest for you to make sure you're including them in your life is what I would recommend for you. It looks like I have a hand raised. Chris has a question. I'll let you unmute yourself so we don't fight over the mute button.
Hi, me again.
Hi, Chris again.
Is there a difference, say, when you're looking at a label, you know, like when it shows ingredients and percentages and such on a food, is there a difference between magnesium and potassium? I mean, things I've read, things I've heard. Again, watching my magnesium. I mean, I'm watching everything, and I take vitamins and blah blah. But if I'm watching my magnesium, then should I be strictly concentrating on if the word potassium is on that ingredient label? Or that?
No, that's okay.
Go ahead. Go ahead.
So what I'll say is, you know, magnesium and potassium you often will find together. It's not anything that you should be hyper focused on, though, as far as potassium. You don't need to make sure you're balancing your intake to make sure that you're not going to push out all of your potassium by taking in this magnesium. You know what I mean? Potassium is much harder to have a deficiency in or to have problems with. It's a much more prevalent electrolyte to find just kind of everywhere. And I wouldn't think that you would have a problem with potassium unless you're medically, much like you're saying, your magnesium has been low on lab work, that your potassium's being low. But I mean, one isn't going to hurt the other.
Okay. An LOL. Chemotherapy, like I said, every 3 weeks is dragging everything down. Not really funny. Not really funny. But again, magnesium and potassium are not the same thing.
Correct. They are two different electrolytes.
Okay. Okay. Thanks again.
You're so welcome, Chris. Anytime. Okay, we have a couple minutes left. If anybody else has any other questions for the chat box, or you just want to raise your hand and talk to me directly, that'd be great. Let's see if anybody else comes through. I think the this caregiver support series that Cancer Fighters is putting out is just wonderful. We spend so much time focusing in on our loved ones who need our care that, I think it's important that we take time to take care of ourselves as well. And it's not a not stressful thing to be a caregiver or a patient, of course. And mental health is something that is definitely becoming more of something that has that's getting awareness around it, So I just want to make sure that everyone is taking a moment to support their mental health with food, with nutrients as best you can. Just think that, the foods that you're eating to feel good now maybe aren't the foods that are helping you feel good long term to best support yourself and your own mental health so you can be the best caregiver possible. So, if you're interested in this type of stuff, there's a lot of resources out there in the world. You can get a hold of the Cancer Fighters who are organizing this and send me any questions if anything comes up after the fact. But also, make sure you're supporting your mental health in other ways as well, whether it's just, traditional find someone to talk to, or I think, meditation isn't as out there as it used to be. Everybody's doing it these days. All the cool kids are doing it. And there's 1,000 apps that will help you with that, to take just a few minutes of mindfulness to really de-stress yourself. Having elevated stress levels in the body suppresses your immune system and will make you more prone to getting sick as well. So definitely make sure you're taking care of yourself and your mental health. So it looks like I had a question come through that I'll take a minute to answer. So this says, with radiation, they say don't eat antioxidants for 3 weeks after. Is it the same with chemo? It is not the same. And that is a great question. So, the recommendation to not eat antioxidants is not exactly true. So you're not supposed to take supplemental forms of antioxidants. So things like 1,000 milligrams of vitamin C, vitamin E, all these things, all these nutrients that act as antioxidants can actually interfere with radiation and its ability to do its job. There is no evidence that eating foods such as just berries because they contain antioxidants do anything for radiation therapy. So it should not be recommended to avoid any type of food as it relates to radiation. So that being said, the recommendation to avoid antioxidant supplements during radiation is valid, but is not the same for chemotherapy, because chemotherapy and radiation work in very different ways, of course. So there shouldn't be any restrictions with chemo, other than maybe some of those nutrients would interact in a supplemental form. Some nutrients can interact with chemotherapy. So again, always good to run that by somebody who knows what they're talking about as it relates to interactions with chemotherapy. But really great question. Thank you for asking.